Eliot Ross Albers heads the international network of people who use drugs. Eliot, thanks very much for joining us on the program. Could we just start by asking what is INPUD, your organisation, and what role does it play in terms of HIV prevention and harm reduction amongst people who use drugs?
Okay, we are the global community-based network for people who use currently criminalised drugs. So we're not about legal medicines, we're about people who are criminalised for their drug use. We're mostly injecting drug users and people who are on opiate substitution programs, but of course we include people who are crack users, stimulant users, people who use party drugs. But the main issues that our advocacy agenda is based around is bloodborne viruses, so HIV, hepatitis C, and all of that is informed by a human rights framework.
And what effect does decriminalisation have on HIV, and criminalisation have on HIV prevalence and other kinds of harm reduction amongst drug users?
Let's flip it around. It's easy to do it the other way around. It's criminalisation that is driving the HIV epidemic amongst people who inject drugs. And it's not just criminalisation of drug use, it's also in many countries criminalisation of harm reduction programs. By that I mean the provision of clean needles and syringes and opiate substitution programs. There is a lack of programs for people who use stimulants, and of course many stimulant users inject their stimulants. So when you can't get access to clean needles and syringes, you are forced, of course, to share. It's sharing that produces the risk of transmitting bloodborne viruses. Now, when you are a criminalised community, there's an enormous amount of stigma and discrimination. And these structural barriers keep people away from accessing what services there are. Often people will be afraid to use services, in addition to which the police will often use people who use drugs as low-hanging fruit to fill arrest quotas. So in many settings and countries, I was speaking to drug users in, for example, Beirut, the police will hang around what needle and syringe programs there are and use possession of a needle and syringe as proof of drug use. So it's the prevention technologies themselves are also used as proof of a criminal act.
And I guess besides decriminalisation, what else do you think could be done to break down some of those barriers that hampering access for people who use drugs to HIV treatment?
For us, decriminalisation is very much the first step on the road to which we need to be at. We need full legal regulation of all currently illegal drugs, because at the moment we have gifted a vast market. I mean, let's face it, drug use is a popular activity. People do it because they enjoy it. People do it because it augments their work, it augments their social life. And some people find life better with drugs than without. So giving that vast market to organised crime means that quality and quantity is not controlled. So we don't know the quantity of the drugs that we're taking, we don't know their quality. And that leads to a whole set of other problems, including risk of overdose, bacterial infections, and of course HIV and hepatitis C. And along with that comes, which I've not yet alluded to, massive human rights violations, which are driven by the fact of our being a criminalised community, who are seen to be beneath or outside of the protection of the normal laws that most people feel protected by. We're very much a community that is driven to the margins of society and away from healthcare and other services that we need.
Well, Eliot, you've raised some really important issues there, and obviously these will be coming up in discussion at the conference this week. So thanks very much for joining us to talk about them.
Thanks for
very
having
much,
me.
Eliot.
Thank you.